History is rewritten, power is concealed, truth is distorted.
We don't create the archive, we reveal it.
Welcome to the Absurdist Archives. American healthcare is a complex, costly system that has evolved through a mix of historical accidents, corporate influences, and political decisions. Understanding how we got here is crucial to finding solutions for a system that leaves millions struggling with costs. In the 18th and 19th centuries, medical care was primarily out-of-pocket and community-based. People relied on home remedies, midwives, and local healers. As medicine advanced, professional doctors and hospitals emerged, but access remained limited to those who could afford it. The first private health insurance plans appeared in the early 20th century as medical costs rose. In 1929, the Baylor Plan, a prepaid system for schoolteachers in Dallas, pioneered the model that later became Blue Cross. These plans spread throughout the country, making hospital care more accessible to the working class. A major shift occurred during World War II. Wage controls prevented employers from offering higher salaries, so they used health benefits as a recruiting tool. This led to the rise of employer-sponsored insurance, which remains the dominant form of coverage today. In 1965, President Lyndon B. Johnson signed Medicare and Medicaid into law, providing health coverage for the elderly and low-income individuals. These programs significantly expanded access to care, but also introduced cost inflation issues due to open-ended reimbursements. The insurance industry gained immense influence over healthcare. In the 1970s and 1980s, insurers moved toward managed care, introducing HMOs and pre-authorizations to control costs. These changes faced backlash, as they often prioritized profit over patient care. Pharmaceutical companies have played a major role in shaping healthcare policies. The US allows drug makers to set their own prices, leading to the highest medication costs in the world. Heavy lobbying efforts have protected these profits, limiting government negotiation power on drug prices for decades. Hospital consolidation has also driven up costs. Mergers have allowed large health systems to dominate regional markets, reducing competition and raising prices. Even non-profit hospitals often act like for-profit entities, aggressively billing patients and accumulating vast financial reserves. Political battles have defined healthcare reform efforts. Democrats have historically pushed for broader government involvement, while Republicans have favored market-driven solutions.
The Affordable Care Act, ACA, expanded insurance coverage, but faced fierce opposition and multiple repeal attempts.
Compared to other developed nations, the US spends the most on healthcare, yet has worse health outcomes. Countries with universal systems, such as Canada and Germany, negotiate lower prices and achieve better results at a lower cost. The US remains unique in tying insurance to employment and allowing high levels of price variation. Several potential reforms could improve the system. Expanding Medicare or introducing a public option could increase coverage without dismantling private insurance. Negotiating drug prices, regulating hospital charges, and shifting toward value-based care could curb rising costs. Strengthening preventive care and addressing social determinants of health could improve overall outcomes. Despite the challenges, history shows that change is possible. The creation of Medicare, Medicaid, and the ACA proved that public demand can drive reform. Whether through incremental adjustments or sweeping changes, the goal should be a system that ensures healthcare is accessible and affordable for all. Please comment your thoughts below. Consider sharing this video with someone who could benefit from seeing it. Subscribe for new content every Tuesday.